Hello, I'm Dr. John Sand. I'm a neurologist and an expert in myasthenia gravis. I'm also on the board of the Myasthenia Gravis Association of Kansas City. And I'm going to talk about some individual treatments and medications for myasthenia gravis. I'm going to start by talking about Mestinon, which, if you're a patient with myasthenia gravis, most patients have been on. The generic name of it is Pyridostigmine. It comes in 60 milligram tablets. There is also a 180 milligram time span capsule that we typically just use at night for some patients. Now, the way Mestinon works is that it makes the chemical communication between the nerve and the muscle that's not working quite well in myasthenia gravis to work a little more efficiently. That is, as the nerve comes down and ends, and it's to communicate with the muscle, it releases some chemical called acetylcholine that travels across this gap and then goes to the muscle. And that chemical, acetylcholine, on the muscle side is blocked in myasthenia gravis. Mestinon makes the acetylcholine stay around longer in this gap between the nerve and the muscle that we call the neuromuscular junction. And it increases the strength in many patients with myasthenia gravis. Mestinon usually is started in a low dose, a half a pill, that is 30 milligrams 2 or 3 times a day, and can increase up to a full tablet or even 2 full tablets at a time, a few times a day. We used to give patients high doses of Mestinon, but we don't have to so much anymore since the treatment is a little better. The most common side effect by far is to bother your stomach, usually some abdominal cramping, maybe a little diarrhea. If the Mestinon doesn't work, then we would simply stop the medication. But if it is working, there are other medications we can give along with Mestinon to make that stomach cramping much better and tolerable. Mestinon is one of the first medications given to most patients with the diagnosis of myasthenia gravis.